Awesome. So good evening, everyone. My name is Michelle Avila, and I am the chair of the Health and Human Services Committee. This is Bronx CB7 Health and Human Services Committee. I'm going to put up the committee agenda as soon as I read the committee guidelines. But first, on February 19th, 2023, Mayor Adams issued Executive Order 339, extending the state of emergency through March 21st, 2023. Accordingly, boards are able to continue to act under the state of emergency section of the Video Conferencing Law, Chapter 56, Part WW. This allows the board to continue remotely. Minutes and video recording will be made available on our website. If you're calling into the meeting on the conference line, the controls while joining are ** to hear all available commands, *6 mutes and unmutes you, *9 virtually raises your hand. And how we will run this meeting is as follows. Bronx Community Board 7 has the right to remove and/or ask a member of the public to leave the meeting or block participation or anyone who engages in inappropriate conduct, including but not limited to obscene or offensive images or languages, personal attack, threats, or any other behavior that reasonably impedes the orderly administration of the meeting. Repeated offenses will be reviewed by the board's executive committee or any other assigned committee for a ban of the participant, the amount of time to be objectively determined by the committee in the event of repeated disruptive behavior. If in-person outbursts or attacks continue, this will be considered disturbing the peace and the authority shall be summoned. Everyone besides the speaker or presenter will stay muted throughout the meeting. After each presentation or speaker is over, I will inquire if the committee members have questions. Committee members may signify that they have questions by raising their hand or using the chat button, or when the chair opens the floor. Members of the public who have joined through the online link will also be able to ask questions and make a brief statement on the item after each presentation and after the committee has had the opportunity to ask clarifying questions, again by pressing the raise hand button on the Zoom screen or requesting to speak through the chat or when the chair opens the floor. Only those recognized by the chair of the committee will be allowed to speak during the allotted time. We will stay on topic with agenda items. Any other new items will be acknowledged by the chair in new business or addressed at the next meeting if there is time and the committee agrees on the topic. Following the questions, discussions, and public comment portion, the committee will begin their discussions after each presentation and agenda item and will conclude with the decision to vote on a recommendation if warranted. When the agenda is finished, the meeting will be adjourned. And if there are any questions related to meeting software to our process, please use the chat function or raise hand function or contact the deputy district manager. Thank you so much, everyone, for your patience through that. So glad to see folks today. It's been a little bit. Can everyone see the agenda on the screen? Okay, so
Yes.
Thank you. So tonight we'll do roll call, revisit any follow-up from previous month, and then a new business will ask our city agencies, Department for the Aging, Department of Health and Mental Hygiene, if they are present and available to give a report, to please report out. We'll also ask our hospitals, Montefiore, North Central, to also share any updates or reports on their ends, and also the Mayor's Office of Immigrant Affairs. We will, as always, ask if there are any topics for discussion or any speakers or items folks would like to see on upcoming agendas, and then we will adjourn. So with that, I will do a quick roll call for the committee. Alfred Grant. Alfred Grant. Alfred, can you unmute yourself? Hi, Alfred. Thank you. I can't hear you. Yeah, okay, perfect. All right, thank you. I will record you. Helene Wilson. Helene Wilson. Emmanuel Asemor.
Yeah, present.
Awesome. Thanks, Emmanuel.
You're welcome.
Daisy Perry.
Daisy Perry present. Hi, everyone.
Thanks, Daisy. Chad Royer.
2024.
Chad Royer, present.
31st.
Thanks, Chad. And Taina Pena. Taina Pena. Okay. Wonderful. We have quorum. Thank you, folks. So I will just open to revisit items from last month's meeting. So two things that I'd like to give an update on. We did talk about doing some follow-up on the rat situation, which we know is an ongoing quality of life issue in CB7, but also across the city. I did not get a chance to speak to my colleagues about doing a collaborative event. However, I know the Jerome Gunhill bid is doing a Rat Academy training in the coming days, and we'll ask our wonderful board staff to send that out to the community. And I do want to work with Chad and our other committee chairs to maybe do a cross-committee forum on rat presence and what we can do as a community and neighbors to really address this. So just wanted to give that update and ask if any committee members were interested in undertaking this effort and helping me plan that as well, or if any members of the public had any interest or wanted to add on to any of the kind of issues we've heard around rat presence. Chad, I see your hand is up. Go ahead.
Yes, hi, good evening, everyone. It's bad when it's like rats in the daytime because they're normally nocturnal animals. And I think the biggest opportunity that we have is if we educate our community at large, including our folks who are responsible for our businesses and our buildings, the supers, landlords, etc. I think if we're able to reach out to them in a way where we get them on board with identifying the issues and then knowing what to do, that would help a lot of us in ways that we will never understand. So that's one thing that I came up with.
Thanks, Chad. I agree with you. I think that there's education that we need to do with community stakeholders, whether that's building owners, neighbors, homeowners, to all kind of do the best that we can while the city at large addresses this rat problem. So I will definitely follow up with you offline so that we can talk about how we bring that to the larger committee, executive committee. Any other thoughts, questions, concerns about rats? Okay. The second follow-up item that we discussed from our January meeting, so we know that the NISNA, the Nurses Association, did reach a tentative agreement with Montefiore earlier this year. And so it was brought to the chat and the public that we'd like to hear from some of the nurses that presented a while back, just to see what they thought about the deal and if there's anything that has changed with the working conditions. So I am working on locating them. Unfortunately, I did reach out and hadn't received a response, but I do hope to bring that back to the committee, if not for next month, then the following, so that the committee can hear from them. Anything else in terms of follow-up from last month's meeting? Okay. So we will move on into new business. And the first agency that we will call on is the New York City Department of Health and Mental Hygiene. Is there anyone on? I believe Kenneth was going to join us tonight. Okay, we'll move to the Department for the Aging. Do we have anyone from the Department of the Aging on tonight? Okay. I do see two other city agencies, two representatives from other city agencies that have joined us tonight. So I would like to give them a chance after we've asked our hospitals to speak, for them to introduce themselves and share any updates that they have on their end. So if y'all can hang tight, after we have our hospitals present, would love to hear from you all. So moving right along, do we have anyone from Montefiore with us tonight? Okay, and do we have folks from North Central with us tonight?
Hello, good evening, Michelle. It's Alfredo. Can you hear me?
Hi, Alfredo, we can hear you. How are you?
Excellent. I'm doing well. Good evening, everyone. So if I can, let me just give you folks a quick update. Oh, I was trying to share, but that's okay.
I can let you share. Hold on.
Appreciate it.
Yeah, 1 second. Okay, you should be good, Alfredo.
Here we go. Thank you.
Yep.
Let me find the right one. So just a couple quick updates. Four in particular, I think it's just good for awareness, right? We all share this neighborhood, and over the probably coming up on 2 years that I've been at North Central, there have been some concerns with one of our parking lots, which lives on the last stop of the 4 train over by, I want to say it's 3604 Jerome, right at the top of the Woodlawn Forest, or right by the Woodlawn Forest Station. And those concerns have forced our hospital to seek other large parking facilities, and the only one that came up was Botanical Gardens. So what we now have for our staff is a full day service. It starts at 6 and at 9. And we're still looking to expand that if need be. We currently only do Monday through Friday. So it's the exact same shuttle service we had prior when we were at Jerome. And for those of us who know the neighborhood, know the Jerome lot was not far from the hospital, but that's not why we implemented the shuttle. We implemented the shuttle to give a slightly higher sense of safety. There were some staff members who had not so pleasant experiences with some of the folks in the shelter next door. And those folks have a right to services as well. So the thing that we tried to do is sort of a compromise. We weren't going to move from the lot, and that's not the reason we moved. We actually have some concerns of the landlord in that lot, and that's the real reason. That's number one. And number two, NCB for good reason is growing. And as it grows and as it offers more services and more enhanced services, we need a complementary staffing model, which going through COVID, we didn't have, right? Many healthcare systems actually have gone in the other direction where we're losing staff. And NCB is in a fairly privileged position where we have folks that want to come and they want to come serve the community. So we had to expand our ability to offer those coming from, Jersey, Pennsylvania, Connecticut, upstate New York, opportunity to park and come in and work. One of the other benefits, unforeseen benefits about the Botanical Gardens parking space is that if you happen to be on the Metro North line, you can get off right there and our shuttles will still pick you up and bring you into work and return you to your train station. So we kind of wound up getting a 2-for-1, and this is not even a week old. So we're still working out a lot of kinks. Needless to say, we're getting a lot of feedback, both positive and negative, and our goal is to get into March with more positive than negative feedback. That will come with a lot of investment. So there's more shuttles and more vehicle operators who will be onboarded, and they'll help our staff still remain that sensation of safety and an understanding that we'll support throughout the day, constant turnaround. So we'll be moving at about a 10-minute or so clip. We did model our movements somewhat to that of the Montefiore shuttle because their staff also parks at this lot. But we have found other routes that I think don't cause as much traffic. We have much smaller buses, so we can kind of move a little more freely through some of the local streets. So that's one. Two, a big push for us is behavioral health. So we actually received a memo from Governor Hochul that there's this huge push for New York City to be able to provide, specifically New York City Health and Hospitals to be able to provide an additional 253 behavioral health beds. We're pushing for, we have 23 beds that are currently offline in behavioral health. Last week, I just received my assessment, and this snippet doesn't mean anything to CB7, but it's just letting you know we have our marching orders and what work we need to do on that unit to be able to open it up and offer inpatient beds to the Bronx community. We're not the only organization. Presbyterian's been tasked, Monty's been tasked, St. Barnabas has been tasked. Everyone's being held responsible to bring online behavioral health beds. I think we've all seen the heightened need for more behavioral health beds post-COVID. So this is just something I wanted Community Board 7 to be aware of. I also want, yeah.
I'm sorry. Could I ask a question? So you have 23 beds right now that are offline. Are you expecting to expand as per the governor's instruction and funding opportunity? Like, will that jump up to 50, or do you think that you all will keep it at 23 for the foreseeable future and then reassess to scale?
Great question, Michelle. Thank you for that. Actually, just based on the architecture of the facility, I can only offer the 23 that we have offline. Unfortunately, just the behavioral health units that are currently active, we can't expand those. And this one, based on the new Office of Mental Health regulatory standards, we can turn the 23 beds we had offline back on. But we can't do much construction to the unit to make more beds. So we're going to stay at the 23.
Thank you. That's helpful.
No problem. And as of today, I don't know if in other organizations, but I do know for health and hospitals, interestingly enough, we understand how important this is, but there's no funding necessarily for it. So we're going to make it happen no matter what. But there may be some programs we may have to pause until the new fiscal year to make sure that this is up and running for right now. The expectation is that many of us open up our units between March and April.
Wow. Wow. Okay. Thank you. Thanks for clarifying.
Sure. No problem. I wanted to give folks a kind of a heads up. We're going to have a new look with our ambulances, and this is for all of New York City Health and Hospitals. Jacoby and NCB, we do a lot of movement between the two facilities. That now that we're an organization that's deemed one hospital, two campuses, there are a lot of individuals that we transfer back and forth. So throughout the course of the day, we make no less than a dozen runs, but overnight, sometimes we make half a dozen runs of folks who really are waiting for a bed on the Jacoby side and need to come over quickly. So you'll begin to see these ambulances. It's a new endeavor that Health and Hospitals is taking on to partner with this company. This company, when we researched it, saw they have some pretty good feedback on in LA. And so they've expanded to New York City, and we have an opportunity to jump on board. And hopefully, internally, we're probably the only ones that feel it. Externally, you wouldn't know, but we have had a greater need for ambulances on demand in higher volume. and in part because of higher acuity to certain patients. So as much as NCB is evolving in its world of medicine, right? Being able to provide medicine to acute patients, to ICU patients, to step down patients. There are moments where we really do need to escalate a person's care to a level 1 trauma center like a Jacoby. And so we're pretty excited because we get to then have this sort of service more readily available and move folks inter-campus a lot quicker. And lastly, something that is kind of like not a big deal, but it's a big deal for us internally, right? So we haven't had the ability to give our staff or our community and patients and visitors just quick access to clean water. We've heard for years the stigma of water fountains, and most folks don't really want to use it. I do have to give a shout out to our environmental service team. They clean these water fountains every day, right? It's a daily task, and I believe it's actually twice a day. But now, in trying to be a little more earth friendly, we were able to install the water dispensers, and this is for anyone, whether you're a patient, a visitor, a community member just walking by, and or staff. And we currently have installed 6. Our plan is to install another 6 and all throughout, so that if you come for an outpatient clinic visit, you can get some water, you can bring your bottle, and then throughout all the other units, folks who come to visit their family members. Sometimes we have folks from the nursing home come in and they have to meet with our team. Something as simple as water was kind of overlooked, and I think had a negative stigma in the sense that no one really gravitated towards the old water fountain that is on the left-hand side. And that's it.
That's wonderful, Alfredo. Congratulations. That is something that is like not so, you don't think about it, but not having it is a big barrier. So I'm really excited that y'all were able to make those upgrades.
Thank you.
Thank you. And thank you for the very informative presentation. I see a couple of hands up from committee members, from members of the public. So I do want to get to them. But Alfredo, I did have a question/request. So when the behavioral health beds or unit comes back online, would you or someone from your staff be open to coming back to our committee to talk about, what kinds of patients you see, what, the community needs to know if they're seeing someone in distress, or how we can make the best use of that service, but also just being really informed about what it is. We don't want to stigmatize folks that need assistance with mental health. And so I think it would be a really beneficial kind of update for the committee and for the board, just to hear about like what the unit does and how we can best serve as spokespeople and advocates for the proper utilization of something like that.
Absolutely, Michelle, that's not a problem. If not myself, there'll be a behavioral health representative that can jump online that day. Again, our expectation as an enterprise, the entire New York City Health and Hospitals, is to be active by March, the earliest, and April, the latest, to be able to absorb any of the folks who need this kind of service.
Awesome. Thank you. Thanks so much, Alfredo. Okay, so I see a few hands up. I'm going to start with committee members. Helene Wilson. Hi, Helene.
Hi.
Go ahead.
My question is, those little blue ambulances, are those for all emergencies or just for mental health emergencies?
Good question. No, it's for everything. It's for everything. So it could be for a transfer. It could be because we have to get you to a special diagnostic exam on the Jacoby campus, which we don't have. It could be to send a child to Bellevue who has pediatric specialty services. It's for the entire New York City Health and Hospitals. And if need be, those ambulances can go outside of our network. So we have 11 hospitals, several clinics, but if the service that we need doesn't exist within our system, those ambulances can go anywhere.
So would they also be able to transfer a patient to their home address as well, or just for emergency services as you had just explained?
So right now they're looking at it as just emergency services. They have not, to our understanding, they haven't gotten to the point where they can discuss it being used as more of an ambulette.
Okay. All right. Thank you.
Sure, thank you.
Thanks so much, Helene. I see Chad, your hand is up. Go ahead.
Oh, I withdraw my question. Thank you.
Thanks, Chad. Okay, anyone else from the committee have a question for Alfredo?
I see a hand up, Michelle. Miss Cruz?
Yes. Members of the public, yep. Go ahead, please unmute yourself. Naki Cruz from the CCRB. Okay, we'll give them a minute. I see Kiba's iPad. Please go ahead and unmute yourself.
Hello, good evening.
Hi, good evening.
Thank you for taking my question. As it relates to the ambulance, so what would happen in the event that let's say the closest facility in the patient's area is on diversion? If like if it's a mental health crisis and the facility that's in their locale is on diversion, what would happen? Would they go out of borough? Would they go to another facility within the borough? How would that work? And
That's
thank
a
you for
great,
taking my question.
no problem. That's a great question. To my understanding and at least my own experience, if the nearest facility or the facility of preference is on diversion, they go to what is the second closest. They're trying to get that individual into care. In most instances, if it truly an emergency, there are conversations where diversion is overridden to get that person into care.
Thank you.
No problem.
Alfredo, can you explain what diversion is, just for those of us that are not familiar with the term?
Absolutely. It's we at the hospital level will put our emergency departments on diversion if for some reason or some multifactorial reasons we simply don't have enough resources to service more patients than are currently in the facility. One example was we had an internal disaster where we had a massive flood in NCB, and during that time frame, the massive flood was in the ED. So we had to halt the arrivals of ambulances. And so for a certain number of hours, we were on what you would call diversion that allowed ambulances and FDNY to know, don't come to NCB until X time, which at that point we were in a better position to absorb. Some other instances is where you have absorbed too many patients. And just from a staffing, we're just trying to keep people safe. And so we may have a number of staff that aligns perfectly with the number of patients. And until we're able to potentially discharge someone or admit someone out of those emergency departments, then we go on diversion for a short period.
That's very helpful. Thanks so much.
Sure.
I see Naki's hand up. Naki Cruz. Are you able to unmute yourself or use the chat? Okay. Alfredo, thank you. Naki, if you have any questions or you can put them in the chat, we'll get them to Alfredo. Sorry, we couldn't hear you. It's okay. Don't worry about it. Feel free to use the chat or feel free to email me, and we'll absolutely ensure that we get your question to Alfredo and the NCB team. And I'm going to put my email in the chat. Thank you. Any other questions, comments for Alfredo and his wonderful team?
Just one question.
Go ahead, Alfred.
How you doing, Alfredo? Just want to make one thing clear is that because of everybody believing that the COVID virus is over, it's still mandatory to all healthcare facilities to wear the mask.
Good point, Alfred. Thank you for bringing that up. Actually, at New York City Health and Hospitals, you are absolutely correct. So, albeit that the city has taken a more lenient stance, the healthcare facilities, specifically New York City the Health and Hospitals, has not. I have not been able to confirm this. I understand that our partners next door, Monty, may have also taken a slightly different route with their masking expectations and policies. We have not deviated from what began back in 2020. We require masking from all who visit. Soon as you step foot past the foyer into the facility, our staff still have to be masked and still have to use their eye protection, depending on the sensitivity of the areas in which they work. So yes, outside seems pretty prevalent that masks are no longer needed, but inside at North Central, yes, you will be asked to please place one. If you don't come in with one, please don't worry. We do have masks readily available at our information concierge desk, and most of our hospital police posts have additional masks available. Good question.
It's an excellent question. Thank you, Alfred. Alfredo, thank you so much. We really appreciate your time and you always bringing informative updates to this committee. Thank you.
Thanks for having me, Michelle.
Thanks so much. Okay, we're going to move along to our next city agency. Do we have anyone from the Mayor's Office of Immigrant Affairs on the line? Okay. And I'll just again ask if we have anyone from the Department of Health and Mental Hygiene or the Department for the Aging. Okay. So we have two folks from agencies, city agencies, Mr. Robert Spencer from the DA's office. Would you like to unmute yourself?
Yes, good evening.
Hi, good evening.
It's my first time being here.
Um,
Just have one announcement. We're having our sixth annual Bronx Child Safety Fair. It will take place on Saturday, April 15th, 2023 from 11 a.m. to 3 p.m. For more information, and I'll send you the flyer because we have to get the flyer approved by our media unit. So once it's approved, then I can send it to you and basically get the message out, and if you want, you can take this number down or I'll put it in the chat. You can speak with the Director of Community Affairs, Marilek Santana. I'll be gladly to put all that stuff in there for you.
That would be great. Thank you so much, Robert. We really appreciate it. And yeah, whenever the flyer is ready, please let us know. Our CB7 staff is wonderful. They'll share it on our email listserv and then also put it on our social media site. So really, really happy to get the word out. And you and your colleagues are welcome to come anytime to share news, announcements, anything that's up and coming on your end.
Thank you.
Thank you. I thought I saw a hand up for Robert.
Yes, it was mine. I had a question, but I just decided not to ask it at this time.
Okay.
I had a question for him, but I just rather not ask it at this time.
Okay.
Okay.
Thank you.
Yeah, and Robert, would you be open to putting an email or your contact information so maybe folks can contact you directly if they feel more comfortable?
Yes, no problem.
Awesome. Thank you so much.
Thank
Okay.
you.
Yeah, no problem. Okay, and Naki Cruz from the CCRB Civilian Complaint Review Board. Is your audio working?
Finally, yes, thank you. I was having internet issues with my, I'm now on the cell phone, so I'm good.
Awesome, awesome. And am I pronouncing your name correctly?
Thank you for asking. My name is Nakai Cruz.
Hi, thank you.
Awesome.
I apologize.
No worries. I'm used to it, as you can imagine.
I can, and again, I apologize.
Right, right. No, thank you. No worries. Thank you for all for, allowing me to be in the room with you all. Hopefully we'll be in person eventually one day. But it's good to be here. I just wanted to do a quick update because I know that I wasn't on the official agenda. Okay, so March 8th, the CCRB is hosting a monthly board meeting. The topic is going to be the Bronx and police community relations. So what we're doing is that's Wednesday, March 8th at 6 o'clock. What we're doing is we're inviting community members within the Bronx. It's going to be hosted at Bronx Community Board 12. I'll include that flyer in the chat, of course. But what we would ideally love is for community folks to come out. You don't have to come in person. You could do it on virtually as well. You could reach out to me directly and I can walk you through. But we're going to have a lot of speakers there, people from different walks of life, whether it's a student who attends, Bronx Community College, or a family living in NYCHA and Mount Haven area, or, other professionals who deal with law enforcement, NYPD directly. We want to hear like the comments, the concerns, and experiences of Bronxites throughout the Bronx. And I think the Bronx, as we know, is one of the most, I don't want to say just marginalized, but underappreciated is the bigger word here. And and let our voices be heard. And so I'll be making my rounds to all the community boards and all the police precincts and all the elected official offices this next week right now, and reaching out and just inviting all community members to come join us, and let's have a robust discussion together. Because take it as a CCRB outreach coordinator and a representative, there's a lot of work that needs to be done, and we couldn't do it without your help and your guidance. So please come and join us if you can. Tell your neighbors. And I also welcome the local precinct. I believe it's the 4-9?
The 5-2. Ours is the 5.
Oh, the 5-2, the 5-2. Okay, so I know the community affairs folks over there. They're already gonna come through. But yes, we appreciate it if anyone can join us, whether you have a wonderful critique and experience with your local police precinct, or you want some improvements to be done where CCRB can do more work. We're at your disposal as liaisons and service providers for New Yorkers. And I rep the Bronx all day. So, I got y'all back. If there's any kind of concerns or issues outside of police accountability, I teach Know Your Rights workshops during police encounters, but I'm also happy to provide the community member of the proper channel, and I'll reach out and do whatever I can to help the community member get to where they need to get. Whether that is job placement, needing shelter, we do that work as well through our community cares initiative. So please, let's build together, and I hope to see you there.
Nakai, thank you so much for that. That's super helpful. We will share it with our board staff, and also I will make an announcement at our general board meeting. I had a question. Are you all putting together a set of recommendations, like this feedback that is being collected? Where is it going?
Yes, thank you. That's an excellent question. So what we do is all of our public board meetings, as I say, they're public. But what we do is we compile reports, and we actually hire minute takers, people who read a testimony and print and write it out. And each of those reports go to every city council member. They go to every state assembly member, all the elected officials that represent us as community members, people of the Bronx, for example. Councilmember Joyner said to attend as well. State Senator Gutierrez, State Senator Guevara is gonna attend as well. And so we're looking to also include elected officials, but the stage is going to be for community members. Does that answer your question?
It does. Thank you. That's
Okay.
helpful. Nakai, can I ask, do any committee members have questions for Nakai?
So right now I'm looking for also, we want to showcase the youth. I'm gonna be at the Bronx Community College tomorrow.
Okay.
Because, you know, that's one of the other areas that we receive a lot of complaints coming from that area. The highest complaints are the 44 and the 40th. However, you know, this is the nature, and the answer is going to be for all of us to come together and develop a community with all parties involved: police, young folks, elderly, community boards, elected officials. You know the spiel. It takes a town to raise takes a village to raise a community, right? To raise a child. So, you know, and that's what we're here for. And if I didn't say it before, you know, we're impartial, we're unbiased. We're not here to, you know, condemn NYPD. We're here to bridge the police and the community relations. And for those who do the misconduct, we're here to also address that. As outreach, we teach Know Your Rights workshops. That's my main goal. That's my main passion, going into the community and teaching Know Your Rights and responsibilities during these police encounters and what that looks like. I'm sorry, I know I went over my 2 minutes. It's just I get worked up about, you know, I'm passionate about the work, that's all.
Yeah, no worries, Nakai. And here, general board meetings have tighter timelines, 2-minute updates, but committee meetings, as long as there's space on the floor, we can accommodate. So we appreciate your passion. We appreciate the information. I do see a member of the public. Kiba, you have your hand up. Please feel free to unmute yourself.
Thank you. I decided to ask my question. I rephrased it, and you know, in the way I'm gonna approach it, because I think that it serves the public as well. I mean, I could reach out to him privately, but I still think that whatever answer he's gonna give would benefit the public as well.
Sure.
Because he's hosting a child fair. My question is, what do you do when you want to make a call to protective services? You understand? You know that it should be done, or you have an inkling that it should be done. Okay? However, you also know that that puts you in harm's way, and it puts your family in harm's way. Is one thing to make this call because you have the option of making it anonymously. You can also give your name, and mandated reporters are obligated to make the call. Okay, but when it's the barrier there is that it puts you in harm's way, and it's really nothing that you can do. You know, it's just no way around it. You know that it'll be some form of backlash, or you're gonna incur some type of something.
Like retaliation?
Yeah, and it's really nothing that you can do about it, but you know that it should be done.
Right.
So what suggestions would you make for the public in those situations? Because on the news you hear like something happened, and you know, they interview the neighbors, and well, I always heard yelling and screaming, but you know, so what do you tell the public in that instance?
So, okay, so I have 2 questions and 2 comments. But what I'm wondering is, I heard you say mandatory reporting. So are you referring to police misconduct? Or are you referring to like childcare neglect and that kind of thing?
I'm sorry, but I apologize. My question
It's
was for
okay.
the district attorney's office, and I didn't realize that it was a possibility that you might respond to it, but it's
Yes.
actually for them. But
Is it pertaining to an officer of the NYPD?
oh no.
I think she's talking about a child. Yeah,
Yeah, I was gonna ask earlier and I thought about how to approach it because I figured whatever response was given, it would serve the public anyway.
yeah.
Well, okay, so thank you for that. I mean, I'll say my piece, and then I think that there'll be another person who could probably address it better, but
Thank you.
let's say, of course, ma'am, let's say we do receive, a complaint, dealing with, immigration officials, for example, or, ICE agents, I mean, or FBI or school safety, or in this regard, the DA's office. Being that that's not the Civilian Complaint Review Board's jurisdiction, while that's the case, we're not gonna just ghost you. You know what I mean is we're not gonna just not respond to you or give you any feedback or any direction. What we would do is we would hear your story, right? And we would what's called refer it out to the proper agency. Now, I'm not representative of what other oversight agencies do. What we do is if we investigate forces of excessive force, abuse of authority, discourtesy, and offensive language, in addition to sexual harassment and assault, in addition to bias-based policing and racial profiling. Okay, and so, but what we would do, let's say it's this case hypothetically, is we would receive the complaint. We have a team, a small team of attorneys that will review what's going on, and then they'll know, oh, this is for X, Y, and Z agency, or I know somebody in the department of X, Y, and Z. Let's say it's a housing situation, which I get complaints about all the time. People see civilian complaint and they think like, okay, I'm living with a slumlord. I have to let them know because he works for the city. I don't just say no or turn them around. I clarify, but also I do get emails directly from the mayor's office of rental rights, right? I do work with rent freeze organizations who are in with the mayor, right? So what I would do is, because I know them on a name basis, I would say, hey, with your permission, hey, I met a community member, this is what they're going through. Do you think you can help them out? What's the process? And that's an easy lift for us as outreach coordinators, because we're all colleagues amongst each other, even the community affairs officers. I know a lot of them by first name basis. And, we work together to build up our communities. It might not be police misconduct in that exact moment. It might be, I need childcare, or I need, whatever the case may be, we have the channels for you. And then I want you to remember that my specific role is teaching educational workshops, and our agency investigates and prosecutes police for misconduct, but we are also city servants. We're servants of you. So yes,
Thank
I hope
you.
that answers your question.
Yeah, I appreciate that, Nakai, and thank you for offering to be a resource, even when the complaint is not within your purview or jurisdiction. So I really appreciate that. I am hoping that Robert from the district attorney's office is still on the line and able to also address this, as I do believe it's related.
Yeah, well, okay. What I can do is basically, I know that when it comes to report, yeah, if there's a crime, if you're a witness of a crime or a crime happens to you, we have a crime victims unit that actually takes care of that situation. Of course, the crime victims unit will interview the person and find out what's going on. I'm a little confused about that question because it was a lot going into what she said. Is she still here?
Yes, I'm here.
Yeah, Kiva, so it sounds like you were, and please jump in. So it sounds like you were saying that in a situation where you as a neighbor or a community member suspect a case of child abuse and you would want to make a report, the person would want to know how to go about that, but would maybe have some concerns about retaliation. And so what maybe the answer or guidance that you're looking for would be like, how could that person make a report without getting retaliated against? Is that what your question was?
Yes, absolutely. Like, because again, if in particular with children, that's, if even if you feel it and if you know it, then It's really no way around it, but how do you go about making that report without putting yourself and your family in jeopardy?
You make a report to ACS, they will determine whether or not.
Because that's part of the reason why people don't make calls to begin with, because they don't want to be, you don't want to subject yourself to any harm. But if it's a fact, or if it's actually occurring, like what can you do?
Well,
Go ahead.
I believe the first step would be you would need to contact ACS. Okay, because that sounds like an ACS situation. However, if there's some sort of retaliation, some sort of harassment that comes your way, that's something that you would first report to your local precinct, and also like let us know what's going on in an email, document it, and again, once it's sent to either community affairs or crime victims unit, we'll basically point you in the right direction with the person that can actually help you with that situation. I'm not sure. Did that answer your question?
Yes, thank you.
And Kiba, also, so I have some familiarity with the child welfare system. So I through my work, so I do know that you can call 311, which is you call 311 for everything. And you can say, I have a suspicion that a child's in danger, and you would give them certain information about the child and where they're located, and then they would do some kind of preliminary high level, like seeing how serious of a threat this could be, and then decide to open an investigation. So I just put that in the chat, and there's an actual web page on the internet that walks you through. And then I also put an informational one pager on what happens when you make a report, so that you can kind of orient yourself or whomever is experiencing that situation with what they could expect. But those reports are supposed to be anonymous, and you can certainly, ACS and the city takes that very serious, because they don't want folks to get retaliated against. So it's not like, they'll say like, oh, we received a report from your neighbor in 3D. However, I understand that doesn't guarantee the complaint person's safety, and there's all kinds of real life situations that are very real. So I would also absolutely follow what Robert said in terms of documenting everything, and then reaching out to additional city agencies if you feel like there's a risk for that person's safety.
Thank you both.
You're welcome. I did see a committee member's hand up, or no, a board member's hand up. Toby, are you still with us?
I'm still with us, and I wanted to mention that you can report those type of concerns anonymously, but since you said it, that's why I lowered my hand. Those type of concerns can always be reported to ACS, even if it's an adult. It's adult protective services. So there are avenues for which a person can report suspicions of neglect, abuse, mistreatment. And it can be done anonymously, and those entities will look into it. Okay?
Thank you, ma'am.
And you can do that through 311. So you don't even need to contact us directly. You can do that by using 311. Hi, I did see your hand up as well.
Yes, I'm sorry to keep chiming in, but agreeing with Alfred and Michelle as well, like the aspect of the anonymous reporting goes a long way. A lot, and so and you could feel 100% justified in saying, I'm fearful of X, Y, and Z, and they will understand that. CCRB, we also most recently we accept anonymous reports, and people cite, I'm scared of retaliation. And, a lot of the times I'll say, if that's what you want to do, we can do that. And this happened to my cousin, I'm going to be a little bit, specific, but he filed a CCRB complaint. And the next day that officer was downstairs from his NYCHA building and said to him, good morning, by his first name. Okay, so like I'm 100% transparent with you with the Bronx Community Board 7 family, because this is all important work that we're doing, you know, kind of raising the bar when it comes to our standards and what we see in the community. As we see in the train station, if you see something, say something. It doesn't mean it's okay to be maybe it's incorrect, but let the professionals dig into that. And so CCRB now has the ability to self-initiate complaints, right? So that will take away any kind of fear of the member of the community initiating it, because we'll just take it over to protect that member. And you know, it's not to say that, oh, I know for 100% sure that parent's doing it wrong, or the 100% sure that NYPD officer's doing it wrong. This is just us kind of, like we said, raising the baby with the community. We're all watchful eyes, and we all want the best for our young people. And you know, and we can do that in a responsible way that also protects ourselves.
Thank you, Nakai. Thank you. And Alfred, I see your hand up.
I just want to understand this. I believe that if a child, it may be a victim of home abuse, when they go to school and they have a bruise or something, isn't mandatory for them to make note of that? Isn't it mandatory for them to have them going to get an examination of some sort? And if this looks in terms of child abuse, then wouldn't this be directed toward family court and establish, I guess, a constant viewing of the family situation?
Yes.
So it looks like there's a process that can be initiated by just one person.
So and I put the one pager in the chat so that folks can see, and it's important for us to share correct information as a quasi-city agency. So once a complaint is made by anyone, whether that person's a mandated reporter, which teachers are mandated reporters, doctors are mandated reporters, or a member of the public, the state central register then accepts the report and determines whether they're going to move forward with an investigation. If they are, they're going to assign the case to ACS. ACS brings a child protective specialist into the picture. They contact the child's family within 24 hours, and then ACS initiates that whole investigation, and they have 60 days to conduct the investigation and reach a finding. And so depending on whether they do find evidence of child abuse or not, then that is when it gets routed to family court, and then you are actually interacting with the child welfare system. So you're absolutely right. I think, you know, there's definitely an importance of having mandated reporters, but also it's really important to have the ability to make these reports anonymously as members of the community, as family, because we know sometimes teachers, doctors, no one person can catch it all. So thankfully, we have a system in place to navigate this, and we are really hoping for the best outcome for our kids and also our families. And we want to prevent them from being harmed, everyone, because it is a traumatic experience, even just having that investigation initiated. So if there is interest in exploring this further, I'm happy to reach out to ACS, the Administration for Child Services, to come and do a presentation, and also happy to connect with other folks that might be interested about this. But there is definitely a process, and we are all responsible for all of our babies. Okay, that really completes our agenda. Are there any items, topic for discussions for any upcoming meetings that folks would like to share?
Hello?
Hi, Kiba.
My last question is, you know, these supermarkets, in the I can't say the whole Bronx, but the supermarkets are required to offer brown paper bags to SNAP users, and they don't.
Free of
They
charge.
do not. They don't do it, and oftentimes you're forced to buy these I mean, what was the purpose of canceling the shopping bag to begin with? Because these bags that they're selling are still plastic, and they do not honor the exemption that is for SNAP and WIC users, and it's really not fair. And it's not just like one supermarket; it's a majority of them. Like I've only seen Western Beef offer the actual brown paper bag, and I think that that's something that needs to be addressed because they get an exemption. It's some type of exemption that they get because of the fact that they receive SNAP benefits and that this is offered to that class of individuals who receive SNAP and who receive WIC, and they're not affording them the opportunity to get these. It's not fair. It's really not. That's it. That's all I want to say. Thank you. Bye.
That's a really important issue to bring up. Thank you for bringing that up. I had not heard about the issue, so we can take this back to our executive committee and see, also talk to our council members and see, you know, what does the law say they have to do? Do they have to put up signage? Like, what can we do to help raise awareness? And to your point, help supermarkets understand that they have to do this. So I really appreciate you bringing this issue up, and we will absolutely discuss it further and see how we can be helpful as a community board. Chad, I see your hand up. Go ahead.
Yeah, I just want to make a comment that for those who take any kind of meds that mimic a syringe or an injection by prescription, it's recommended that they toss them in a medical waste approved setting, like in a hospital. But what I'm finding is that I've gone to 2 different, what is it called, city MDs. And for whatever reason, they do not allow folks to return any of those medical wastes, despite the common warning that they support tossing it properly. Because what I'm going to end up doing is tossing it in the garbage, and that's going to end up in the landfills. I
Yeah.
don't know if this needs to be brought up on a different scale, but I think it would be good for such medical facilities that provide urgent care, at the very least, in the absence of a hospital setting, to be able to receive those kind of medical waste so that they can be discarded properly.
Thank you, Chad. We can definitely look into this as well.
Right.
It's an important issue. I'm not familiar with the issue in terms of what they're required to do, so I will definitely look into it, and then we can explore how, what, if anything, we can do to have them be more open to allowing folks to dispose at their sites.
Thanks.
Thank you. I see Daisy, your hand is up.
Hi, I just wanted to kind of add something to what Chad was saying. And it's kind of like a personal thing, but I'll share. There was a part of my life where I was administering diabetic medication via like syringe into my belly. I was told by the doctor that once you finish with using the needle, you have to put it in a plastic bottle, let's say a water bottle or a soda bottle. And once it's filled up with the needle tips, then you dispose of it, because like Chad said, there's really nowhere to turn in the used like needles, I guess, for medication, or what if it's called like medical waste. There's no place for it.
Thank you, Daisy. That's helpful. And I'm also just writing notes, because I think that's helpful also in terms of when we're looking into the issue, hearing what medical professionals are saying versus like what's mandated. Hey, Alfredo, I see you came online. Did you want to add anything to this?
This is actually, yes, thanks, Michelle. This is a really good point. And I don't know if folks know, in many of the health and hospital lobbies, such as North Central Bronx, we actually have a red bin, which is the appropriate disposal unit for such syringes. And this is a community service. It's not specific to the hospital. It's not that we use it. We put it so that folks have a safe place to discard. I just, off the top of my head, I feel like I'm seeing it in Lincoln, I'm seeing it in Jacoby. I can tell you as my facility and I'm responsible for North Central, when you come in the lobby on the right-hand side of the information desk, we have a red bin, excuse me, and that red bin is for exactly what the community right now is discussing.
Thanks so much, Alfredo. That's really, really great to know. Thank you. Alfredo, is there like signage or like a flyer or something?
I'm going to take a photo of it and send it to you, Michelle. There is signage. It is, if I think about it from an end user perspective, the signage is on the bin itself. There isn't necessarily something that will take your eyes there, other than it's the only red piece of equipment in the lobby.
Okay, that's helpful. Chad and Daisy, maybe we can talk about how we like spread the word out to community members at CP7 so that they can at least know about this resource that's like right here in our district. And then while we look into what entities like City MD are responsible or required to do. So if you all would like to help with that, I welcome the partnership. I think it's also like we have this knowledge gap.
I'm in.
Yeah, it's great that Alfredo is here and can make us aware. And then we also have to bring the information to the community. So would love your partnership there.
Sure, yes, and let's tie it into like wellness and maybe diabetes awareness and all.
Yeah, would love that. Awesome. I'll connect with y'all offline. Thank you. And thanks, Alfredo. Super helpful.
Thank you.
And then I see Nakai, you have your hand up.
Yes, last time I promise. Thank you, Mr. Jones, for that. That was very helpful because I was thinking, Healthy Human Hospitals must know something about that. I've seen these bins in a lot of, and I know this isn't like a solution, but I've seen these bins in a lot of, believe it or not, private companies and private organizations. So for example, I was at a Whole Foods, and I know we don't have that in the Bronx, but just think of like these places, and in the bathrooms, there's take a good look. There's often disposable sites there. I'm not saying this is what should be used for our clinics and for our organizations, but I think it can be a push that we can emphasize. Like the city most recently has rebolstered their mulching initiative where sanitation's picking it up. This can be a concern of sanitation workers who are picking up garbage bags. They don't know if there's needles or something in there. You know what I'm saying? So maybe there's also additional channels that maybe we have sites in the community that we're not aware of. But I definitely lead towards Mr. Jones in terms of like what kind of databases there are. But outside of the Health and Hospitals Network, because I'd be curious to hear that as well. I work in a lot of the shelters and at-risk groups throughout the Bronx. And I know that that's a constant concern for them as well.
Thank you, Nakai. Yeah, we can, Chad and Daisy, I think maybe we can all collaborate on a research kind of initiative here and see what's available in our district and use that as a starting point, do some promotion around what we have, and then think about how we tackle what we don't have. And reach out to partners, our government partners about that. But this is a great issue. Thanks so much for bringing it to our attention. You'd like to help? Okay, Toby, I'm putting you in the committee too, in this little subcommittee that we have going on. Thank you. Awesome. Anyone? Oh. Go ahead, Toby.
I just said you're welcome.
Thank you. Okay, anything else before we adjourn for the night?
Yeah, hello, can you hear me?
Hi, Alfred. Yeah, now we can hear you.
Yeah, I just want to make it clear is that we're getting to be in the stage where in the hospital we will be being offered to take the regular yearly flu vaccine. But I understand that there will be the other vaccine that will be added too. Now, these are not actual things that you must do, but these things will be offered. Now, it seems that, when we come against this COVID, we looking for it to subside, but the yearly, what they're proposing for us to take is yearly, these two vaccines. Now, as people who are getting older, I mean, we filling our bodies up with all kind of junk. So the thing about it is that this is a hard thing to say, yeah, I'll take it, or I don't want to take it. And this is something that looks like it has to be dealt with on case by case, day by day basis on if I will or won't I or whatever. But it's confusing, but it's here.
Thank you, Alfred. Um, Alfredo, maybe we can also talk about this for next month's agenda, maybe when revisiting the vaccine mandates and how things will continue moving forward as we kind of weather the pandemic, because I think it's different, right? Like Alfred, you hit the nail on the head. So from what we hear public health officials saying, it looks like the COVID vaccines are going to be introduced similar to like flu vaccines. So you can get one on a yearly basis. And we're moving to that model, just understanding that COVID is not being eradicated. It's unfortunately here to stay. So that's one thing for the public to know and understand. And then whether you work in a healthcare facility and there's additional concerns and mandates, Alfredo, I would absolutely welcome, to the extent that possible in March or later on in the spring, what you all are moving towards. I think that would be really helpful to know as well, and for the committee to learn about, just to understand both perspectives.
I'd love to bring back whatever we get. I think to Alfred's point and to something we touched on earlier. So there's the cadence of New York City, and then there's a cadence of New York City's healthcare systems when it comes to our responses to COVID. And they're, in my humble public health opinion, they're no longer aligned, right? And so the public health perspective, the healthcare enterprises and systems will do in their four walls what they see best, which is already showing its true colors right now in this very concrete stance that our particular healthcare system has taken on masking. The hard stance that I think is now a year old on vaccines. And to Alfred's point, I think time will tell, but even the flu shot is something that is optional, but it comes with caveats, right? So you have to sort of prove that it's probably not best that you take the flu shot, depending on what industry you're in. And again, the conversation of what is the right thing to do to keep everyone safe. And if you're going to work in the healthcare industry, that may be one of those conversations that folks begin to have. And it's a sensitive topic because of COVID, we have watched a massive amount of our workforce leave, whether it was retirement. Some folks, may they rest in peace, that we lost in the COVID battle. Some folks who said, this is no longer for me, right? It's taken everything out of me and I no longer want to be in healthcare. So we're trying to usher in this whole new workforce, and this whole new workforce and the current workforce will need to sort of stay aligned on what our future is. So I hope that in March, I have some updates for you. I'll be transparent and say, we're not always the quickest organization. It's like doing a U-turn in the Titanic, but whatever we can get, we'll get back to you.
Thank you, Alfredo. That's really helpful. And yeah, we'll keep this on the agenda. Alfred, thank you for raising the point, and we'll monitor it on both perspectives, right? Like what the public health officials are advising for everyone. And then of course, having two large entities, healthcare entities in our district monitoring what they're requiring of staff. And I mean, even to the point of masking visitors too, right? Like it's important to know that if you're going to North Central, you still need to wear a mask. So okay, thank you. Thanks, everyone. Anything else, or do we have a motion to adjourn?
I just want to say thank you to Alfredo and all your colleagues. You know, I like many of us, I lost some good people during that time, and I was able also to see some good people who may have not had their lives, may not be here anymore if it wasn't for the work of the physicians and nurses and all the work that everyone in the hospital has been doing. And I definitely understand, um, I also deal with lack of trust in the community when it comes to police accountability. Like, I work for the government, so people don't trust. But I think it's super important for us to be in these meetings and speak with one another and meet at the table and just have an understanding of what is going on. And also, we're not dismissive of anybody's concerns or hesitancies, and let's just continue this discussion. And again, I just gotta thank you and your colleagues, Alfredo, for the work and the foot soldiering work, quite frankly, that you've been on the front lines for so long. And thank you.
Appreciate that. Thank you. Thank you very much, brother.
We are very fortunate. We're very fortunate to have some wonderful, wonderful entities and people that are the heart of those entities. So thank you to Alfredo and North Central. You all always show up here for CB7 for our committee, and we are very, very grateful for your partnership. So thank you.
Thank you all. Appreciate that.
Thank you.
Everyone. On that note, any committee members want to put forward a motion to
I
adjourn?
move to adjourn our meeting.
Is there a second?
Yes,
I
I move
second.
to adjourn the meeting.
Awesome.
I second.
So all in favor? Aye.
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 All right, everyone. Thank you so much. Have a great night.
All right, good night. Good night, everyone.